So, thank you everybody for joining us today. We are here on today's webinar, Retrospective on Coronavirus Initial Response. And this webinar is really something that came together out of this need to look back and see, how this very unusual situation played out for the first time. It's not very common that everybody's emergency plans actually get put into use, let alone all at the same time. And, as we all know, I think from our experiences doing emergency planning, actually having those go into effect, you can do all the preparation you want, but rarely does a battle plan last through an encounter with the enemy. I think it's something along those lines. So the thought here is let's look back, see how we did, and then use those lessons to look forward again in the event of a second spike, or, because emergency planning and emergencies and disasters, unfortunately, don't stop just because there's a global pandemic happening. And then how do these things change as we realize, these things could be compounded with a hurricane or a tornado or an earthquake or, any other myriad issues. So I'd like to go ahead and introduce our panelists for today. So with us today, Sarah and Larry, if you guys wouldn't mind just sort of giving a quick overview of your organization, your role there, kind of how things went, just give us some context as we get into the question portion of the webinar. So Sarah, would you like to kick us off?
Sure. Hi, everybody. My name is Sarah Ells. I'm the Director of Environmental Health and Safety at Northern Arizona University in Flagstaff, Arizona. We have a lean team of 8 professionals who cover health and safety for all of our campuses statewide. And our pandemic, we have a very comprehensive pandemic response plan at NAU, and many parts of that went slipped into place really easily. We had a lot of groups who are very well positioned to respond and hit the ground running and had tried and true action plans that they had practiced with. There were a couple of our departments, and ours was one of those, who had recently reorganized. We had taken a decentralized model of health and safety on campus and centralized it and reorganized under a fairly new division on campus. And so what those parts of, defining everybody's roles for safety had not been updated in our pandemic plan yet. So all of the tasks around safety that we all would expect to see in a pandemic response, the ones we can anticipate, the respirator fit tests and all of those things, were part of the pandemic plan, of course, but our team had not been defined in that role. Now, luckily, we're a very collaborative university, and it became obvious right away that we needed to restructure things and define our roles. But I would say the biggest lesson learned for me in this pandemic response was just really recognizing the importance of making sure that when you reorg and you move around tasks and you re-centralize safety positions and duties, that would be reflected in the pandemic response plan. And in all other aspects, we're active. The EHS team, we're active members of our emergency management advisory group, and we're in contact with all of the groups involved in the pandemic response regularly. So those groups, such as Campus Health, who would, foresaw the need for respiratory protection, they were well prepared and we were involved with that. But on paper, if it's going to be your playbook, I would have gone back and made sure that we updated that part of it.
Thank you. Anne?
Hi, sorry about the video. It seems not to be working today. I am the industrial hygiene manager at Clemson University. We have a staff of 15 health and safety professionals, and we cover our main campus, which is about 20,000 acres, and we have a total of 22,000 undergrads and 5,600 graduate students. And our main campus, we have a very large main campus, but we also, because we are a land grant university, we cover 13 different other off campuses and research sites and collaborative efforts with various manufacturing. So as a pandemic started to plan out, we had to have an emergency operations center, but we didn't really have a pandemic plan, so to say. And so it really had to start becoming developed back in February when everyone thought that something could be happening. And so it was pretty much learn as you go. But what we did have in place was we had a lot of emergency response plans for other things that we were able to institute, whether that was for a hurricane coming into the area or a major power outage or tornadoes. And so we activated a lot of those individual parts of that to be able to respond to the pandemic. One of the good things that we've done is we have built a network of building security coordinators and a network of department safety coordinators across all of our campuses. And the first group is responsible for the building security, not so much safety, but it has to deal with a lot of entry, emergency response, that type of thing. And then our department safety coordinators are feet on the street for us to transmit information, to basically be able to bring information to us, help with accident investigations. And so they could be part of a couple different buildings, but they're for one particular department. And so we utilized everybody in those groups to help institute our plans. And so that was very effective because not only do we have the undergraduate and graduates, but we had we have farms, we're a land grant university. And so we had a lot of different pieces to kind of pull together. But because we had that infrastructure built with our coordinators, that made it very easy to do, be able to send out notices and to work things out that way. And I can spend more time talking about anything, answering some questions about what we've done. So.
And we'll certainly get onto that once we're done with these introductions here. So Larry, certainly last but certainly not least.
Sure, yes. Hi, I'm Larry Mendoza. My official title is Laboratory Safety Officer. And my specific role is that I manage the lab safety team with the inspectors, lab inspectors, and I also manage the hazardous waste program. So, unlike some of the other universities, we didn't really have a pandemic specific plan. Obviously, we had an emergency response plan, which we put into effect when this all kind of came down. It did catch us off guard a little bit because things started moving quickly once the governor started, putting out these executive orders. We had to really, get things moving, and we weren't really sure where things were going to go. We started hearing a lot of rumors about what the governor might say, might not say, so we had to really learn to adapt very quickly. But we immediately put together the incident command team, which is all pretty much upper leadership, and started working down from that. In April, I think it was April, we were then mandated to start teleworking. However, most of us are considered essential employees, so we had to figure out how to sort of go and take shifts and coming into the office. The other part that that really we had to really take into account is the fact that we also support the hospital. So VCU is a pretty large university with 2 campuses, and we have what we call the medical campus, where all the medical school is located, and then our academic campus, which has every other school, business school, humanities and sciences, art, things like that. And the medical campus, that's where also it's right next to also the VCU health system, which is a large hospital that we also support. Part of that support involves continuing hazardous waste pickups. They use our 90-day facility for all of their hazardous pharmaceuticals. So we had to, we couldn't just stop. We had to be on site. We had to continue to support. So it was very quickly figuring out shift work, who comes in on what days to minimize density in the office, and we had to coordinate with the different sections, in our building, and make sure that we weren't, overcrowding and maintaining the 6-foot distance. So, the biggest challenge for me, the university had, there was a number of challenges we can talk about, but for me specifically, was figuring out how to, have a staff that is supposed, it's lab inspectors. You can't do lab inspections from home, especially since research was shut down. So how do I keep them busy? And that was a challenge, and I can talk a little bit about that as we move on.
Great. Yeah, thank you to everybody for the context here. And I think this is a great launching off point for our discussion. So Larry, I'll actually kick this over to you first. So with the advent of coronavirus, many routine practices were suddenly thrown into chaos. I think we all have experienced that in life and in the professional field. What successful strategies from your initial response could be valuable for a second spike should that?
Yeah, so the biggest thing I could say as far as strategies that we learned and we seem to have gotten our handle on is figuring out roles and responsibilities. And now, and who does what. I think that was a big challenge for us because, from the university, one of the, not just in our office, but one of the good things that we have now is we have identified and appointed what we call, well, they're called return to campus coordinators now, but these are people that I think in the next round will certainly be playing a big role in organizing things like research ramp down. So, at first all of this came on us to figure out how do we ramp down research while still maintaining, some essential functions moving, things like tissue cultures having to have to be managed and things like that. So the Office of Research was the one that was sort of managing a lot of that, and it got very chaotic. People were very confused. Communication wasn't always coming across. People were interpreting things differently, things like that. But we, now that we have a better system in place, I think if we have to ramp down again, we'll have appointed people in every major business unit, meaning, the schools and the departments that will have an official person that people can go to and say, okay, what do I need to do? It'll be a lot better, process flow. So that's a really big thing. I think that every university should, assign, people that in every unit, we can't be anywhere. And we have, we're a large university, a large public university, 2 campuses, we can't be everywhere at once. So we do rely on everyone to sort of help out, especially in a situation like this, which was unprecedented. Nobody, unless you were alive in 1918 and still working, I guess, that was the last time we had to deal with this.
Or you were one of the debatably lucky few who got to experience outbreak control during Ebola, MERS, SARS. Yeah.
Right. But even Ebola and MERS and SARS, we didn't shut down the way we did with this. So, there's some, I think we are definitely, everybody on this panel, everybody in past panels and across the country is writing the playbook for pandemic. And what I've noticed is in this, I like to not ever, if I don't have to reinvent the wheel, I don't. And so I did reach out to a lot of colleagues and a lot of people like, what are you guys doing? So that seemed to also help because it seems like everybody's was pretty much on the same, everybody brought a little different idea, but we were all thinking along the same lines, which gave us a little bit of reassurance that we're doing things right. But yeah, assigning roles and make sure people understand what their roles are is a huge, huge thing for next time.
Sarah Ann, anything you'd like to respond to there before we move on?
I agree with everything Larry said. I mean, everything changed and we had to be able to figure out how to incorporate change into everything we do and uncertainty in everything we do. And we had those same challenges that Larry had.
I would agree as well. We actually had some things that were unforeseen. Clemson is a college town, and we actually found out that the fire department, we provide health and safety for them as far as respiratory protection and fit testing. For our police department, we don't do that. And the city of Clemson police really didn't know what to do. So we had to educate people on wearing respiratory protection, having everybody trained, medically cleared. And really we realized we needed to really do a lot more outreach to these groups because they had, aside from the firefighters and the EMTs, they had never experienced this before. And so that was something that was completely unforeseen for us. And we found that there were groups, even though we had building security coordinators and DSCs, we still were finding groups that weren't covered by those because of the fact that it was so encompassing and there were so many challenges every single day.
Yeah, absolutely. I mean, with just the huge burst of information going out, with everybody trying to sort through that, it seems like having that leadership in providing accurate information, not just within an organization, but also outside to the relevant community groups, could really help to stabilize things and get everybody sort of on the same track, working together better. Sort of on that note, Sarah, I had a question for you here. So during the initial response, there was a strong need for reprioritizing responsibilities and workloads. What were some of the takeaway lessons that you had from your experience reprioritizing things that could be beneficial going forwards? Again, should more reprioritizing, more reshuffling be necessary in the event of something unexpected?
Yeah, I think we're going to continue to do that every day heading into fall. But just to provide some context, we still had quite a few people on campus throughout the early stage of the pandemic, even during the executive order to stay home. We have a very high percentage of students who live on campus at NAU, and students who didn't, international students who remained on campus didn't have someplace to go, and then a fair amount of students who remained on campus so that they could continue their online curriculum and didn't have connectivity in their permanent address. So for one thing, we had people on campus, and then we had a lot of essential personnel still on campus in order to support those continuing operations. So for our office, of our team of 8 in an open office space, we really tried to keep about 2 people on campus to take the initial concerns about being an essential person and staying at work when everyone else is being told to stay home. We worked really closely with those groups and we couldn't drop everything else, but we certainly that was the top priority, was taking care of the folks who were here as essential personnel, making sure that we were, trying to overcome some of the supply chain issues and make sure we were going to have enough PPE for the folks who are on campus. So that was our top priority when things really started changing on campus. So then, came the Zoom meeting blitz of back-to-back Zoom meetings where, I personally found myself in the position of not even having time between Zoom meetings to delegate something or share that a priority had changed. And so, that took some getting used to. So that was a big challenge in the beginning. And then, of course, there are, I'm sure everybody deals with the budget line issue of, all right, here's what we need to do and here's what we need to order. Who's paying for it? So those were our challenges, just to set the stage. Mm-hmm. If I had to go back and give myself a better pep talk at the beginning of all this, my lessons learned would be to just accept that there were a lot of things we didn't anticipate. We couldn't anticipate in the pandemic. To understand that there was going to be a fair amount of uncertainty in everything we were doing, and will continue to be, and to be flexible about that. To make a concerted effort to keep everybody on the same page on our own staff in a rapidly changing environment, to have folks working in different places, some remote, some on campus, that presented another challenge. But the priorities, as Larry said, lab inspections slowed down, but exposure risk assessments were a new thing that we were doing, and that ramped way up. So to the credit of our team here, everybody just has been jumping in and rolling up their sleeves and saying, okay, this isn't what I normally do, but this is what we're going to do today. And so those priorities continue to change. I mean, they truly change almost on a daily basis, sometimes more than once a day. And so I guess my lesson learned in this situation is, do the best you can, always put your best foot forward professionally, make sure you're taking care of people on campus and people on your staff, but just recognize that you're going to have to be flexible, and you're going to not be able to plan the way you normally would.
Great. On to a question here for Anne. I was wondering if you could tell us a little bit about what you did to manage information distribution during the early stages of the pandemic. I think we can all remember the exhaustion pretty early on of trying to sift that good information from the bad, figure out whether the virus really was being transmitted through surfaces. I personally remember that time where there was that very confusing article about the Diamond Princess, and I think the big thing being thrown around the 17 days on surfaces, which really threw some people for a loop. So what did you do to help manage that information, and how do you feel that could help with your future emergency preparedness efforts?
That's a very good question. And I think like a lot of us, I felt that in my entire career, I've never seen things move at a breakneck speed, and you go to sleep at night, wake up in the morning, and things have changed. And so I joke about the fact, but this is really what happened. Is every morning, I would get up bright and early, review everything, and then a lot of the information was going from the ELC to our department because they were integrated with everyone across all the campuses. And we would review the information. Everyone had separate teams as far as our group went, whether that was dealing with just the researchers who were trying to stay on campus, dealing with the students in housing and dining. We were at the point where when we closed down on March 16th, that was the start of spring break. And so the students weren't allowed to come back. And as a matter of fact, they're still emptying out the dorms as we speak. We're in, I think, the third week of that. So we went completely online, so they were working with that. But the biggest key with that is that and I think all the different organizations, whether it's AIHA, ASSP, CDC, I mean, it just got overwhelming, was that I ended up being like the channel for that information and then spreading it out to people and summarizing it. But we were getting an influx, and probably you are the same way, of people were concerned, and a lot of employees were concerned, and they wanted, if they want to come back to work, even though everyone was working off site, they wanted certain things in place. One thing that we had to be able to channel that information is our community, especially our research community. We have been doing fact sheets through the DSCs and the BSCs for probably the last 4 years. And if you check out our website, you'll see, and they're one-page summaries to get the information out quickly. And we were putting them out. We would do usually one, maybe a month, maybe two a month. And we were putting them out at breakneck speed. I mean, it was just like full overdrive of trying to summarize the information, get it out there in one piece. And it was coming from our office or through the ELC. Certain things that came up, like, okay, we have people that go between campuses still that are essential, and they're riding in cars. How do they social distance in vehicles? So, okay, let's put one together for that. I mentioned the fire department and the police department. How do you take care of your N95s? What's the difference between all these masks? How do you wear a cloth face covering? And when we update them, they are electronic. Then we would blast it out to the DSCs and the BSCs and through various email blasts to all of our areas. And I can't stress enough, I think, Neil, Larry, you mentioned that is having like your advocates out there and not being in one place at one time. And so we really utilize that channel of information. And I can tell you the one thing that we have learned with this particular pandemic is that information does change, because a lot of times we make programs, we do training, and we maybe look at it once a year if we're lucky. Here, we might have been updating the fact sheets, the next week, all of a sudden we're changing the information, and that blast had to go out. But it was real important for us to keep the employees and the faculty and staff up to date on that information. And a lot of that was driven by our ELC and their partnerships. We had a lot of questions about PPE like everyone else had, but having a fact sheet or having a central location for that really helped a lot. We've always gotten positive feedback about them, but this was something that we have recognized now. We need to take a look at these fact sheets that we've done before, because information might change fast. And trying to incorporate the fact sheets, like, do I wear a mask in the lab, but I have to wear eye protection? Why do I have to wear all of this? And it's kind of like, well, you still have a risk of an eye injury, but you also have the risk of coronavirus or infecting someone else. And so it's a matter of getting that change for people to accept.
Yeah, this is a great time to really go ahead and get people more educated with high quality information as we have it, because in the event that things become frantic again, I think that those investments will really be repaid several fold.
One thing, if I may jump in real quick, is that we were lucky, VCU, because we have a hospital. And so one of the things that we did early on was put together a sort of a public health team that had infection disease specialists, epidemiologists. So, and then we kept updating, website, with all the latest info. So it really helped that we had that resource, and I know not all universities have a hospital that they can exploit like that, but we did. And so that also helped with managing information. This team did a tremendous job. I mean, they were, beyond busy, as you can imagine, and trying to make sure people had the right information, the most up-to-date information, with the caveat that things are going to change maybe in 10 minutes, maybe tomorrow, maybe next week. And so that really helped us.
Mm-hmm.
Great. And before we get on to our next question, it looks like a lot of folks here have found the Q&A panel there. So we are going to have a live Q&A portion at the end of this webinar, towards the end at least. And feel free to go ahead and go in there. You can ask questions and it'll be a little easier for us to keep track of the questions that are being asked if you use this Q&A feature. But you can also thumbs up questions that you're interested in, and that way we know which ones we should be addressing with a higher priority during the Q&A, and you can respond to each other's questions. That way you don't have to wait for us to address them. Have some great side conversations as well. So here's a question just for all of our panelists here. As I was listening to all of you speaking, this kind of came up and seemed like could be a kind of nice thing to touch on, which is this element of kind of organic leadership. During these times of crises, when things are stressful, people are running around, you're reprioritizing your workflows and your resources, you're trying to determine what's going to work and what isn't. Sometimes people come up through the cracks to say, hey, I'm willing to take on this extra responsibility, or I have an idea that I'm willing to really shoulder the most of the work for at a time when many of us are very stressed. What do you do to balance the times where you have somebody where you say, oh, I'd really love to have you do this thing, but that's not actually that great of an idea. Maybe you're not seeing everything, without tamping down all of that enthusiasm so that you can, of course, expand your effect beyond just what you can do yourself. And Sarah, do you want to take this one first?
Sure. Yeah, it's tough when there are so many tasks coming in, in the direction of your staff, and things are changing so quickly, and you do want to harness all that enthusiasm for trying to change. And we've all discussed, not just on our team, but as a division here, that it's difficult sometimes because you might be doing a new task that you're not exactly sure is in your lane, and you're trying to stay in your lane yet try to help out. And so there's a lot of that. But I think what we have tried to do is allow people the opportunity to focus, to start a project and finish it. So to Anne's point about having to revise documents, we've had to revise documents before we've even published them, and so we try very hard to identify the task, ask a lot of questions so we understand exactly what that task is and how it's going to help, and are we going to be authorized to do that and publish something, and then focus on it. That's, I think for me, I'll be honest, focus can be a challenge for me sometimes because I like to be busy and we've got a lot of things going on, but I try to just come in each day and say, all right, what do we have going on today and what can we do? Focus on that and then move on, because tomorrow it'll be different. That's helped me anyway.
I think I have my IH team has been there. I have a couple of seasoned folks, and then I have a few really new folks right out of school. And so I keep telling them that they're learning health and safety by fire, because the regular hazards, but now we're dealing with a pandemic, and we're all pretty much learning about it all at the same time. So they have a lot of enthusiasm, and they kind of bring a different twist into that. And one thing that I have found is they've worked for me for about a year, so I had a good idea of where their strengths are, is to really give them an area that they're really strong in and that they can really research it and pull all that information together. So they're not trying to learn a lot of new things that they don't really feel really comfortable with. The one thing that's helped, because we haven't really been in our office since March 16th, we go on site when we need to be, so to keep ourselves safe. We're still in phase 1 with bringing people back on campus. So we have team meetings 3 times a week. Our director requires every group to have an idea of what are we going to do for, what have we done the last 2 weeks? What are our plans for the next 2 weeks? And one of my younger employees had responded when I asked him that question. He sent me an email and he said, he listed his tasks he's hoping to do, and then he said, and anything else that I don't know about yet. And I said, that about sums it up with that. But it's hard, to Sarah's point, to keep people focused. And a lot of the times when we would meet as a team, it was, let's get things done. But it was also about, how are you doing? You know, how's your family doing? You know, do you have any concerns that you want to talk about? And I found out that when we started with that, then people would talk about how they felt. And I also spent time with people individually doing Zoom meetings to keep that focus and to see what they would want to take on. I found out that not our department, but some other areas, they felt like certain people were doing more than someone else was doing, and they felt completely overwhelmed. And I think that is really important, to make sure people stay focused on the work, but also to know that they need to take care of themselves first too.
Yeah, I mean, I, echo everything both Sarah and Ann said. One of the, again, the biggest challenges, for me personally, we hired a new technician in February. So talk about welcome to VCU. Now you're gonna be working from home, and she's been great, but it's been a little challenging in trying to, because I don't know her strengths yet. I don't really know where, but having said that, I think that's one thing that I did first off. The minute we were told, okay, we need to telecommute, I said, here's what we're going to be doing. We set up a weekly, we did a weekly team meeting, and I developed, pretty much a spreadsheet with everybody's name and every project to keep track of where we are. The challenge becomes, and this is something that in the beginning we started faltering a little bit, but now I've gotten a lot better, is, I think somebody alluded to it, is finish a task first, because it's really easy to get caught up with all the shifting priorities, and then you end up with like 50 things that are half done, and that helps no one. So it really helps to kind of, set deadlines and set deliverables, but with the notion that it's not a hard deadline, and with the understanding that things can be shifted around. But that kind of kept, my staff at least with a goal in mind to move, and with specific projects and goals. And I always, my staff knows me that I am, I hate the word manager. I don't manage. I'm a team leader. And if there's an idea that I present that they don't like, speak up. Let's talk about it in these meetings. And so, I tell them, if you have any ideas how to make this better, speak up. And my team is not afraid to do that, which is great. It keeps me in check, and it keeps the process in check. So I think, the big thing is, focus on a priority. Now, priorities do shift, and sometimes we have to move away and take care of something. But, but then as soon as that's done, then come back and finish that project. And instead of starting another one and then starting another one. So that's, I think, a big challenge. Regarding, the change in work, we were, this sort of forced our hand into actually start to address some of these back burner projects that have been sitting there. Actually, not even back burner, they've been in a crock pot stewing for even up to a couple of years now. And so we were able to actually start working on some of these things while we were also addressing the emergencies, the changing things. So, our website content needed to be drastically updated. Training, our web-based training was fantastic. I mean, I had, one of my employees, she loves to do training. She loves to develop training. I said, run with it. So we've already updated, I think we've done 3 or 4 new, modules for that, so, it's just, but you do want to present the team with a vision and be open and not try to make it sound like you're hiding anything. And every time I would get communications from my leadership on down about updates, here's the number of cases we have at the hospital. Here's the, this, that, and the other. I would forward that email to my staff. It's like, here, transparent. Here's what's going on now. Here's the priorities for the coming week.
Great. They're going to have to interrupt you there just for me to move on to other ones, but fantastic here. So I wanted to get through just a few more quick questions here before we transition over to the Q&A. So I'm going to just go through these hopefully pretty quickly. And Sarah, the first one here is for you. So looking back, what do you wish you could have done differently during the early stages of your coronavirus response?
Gosh, I feel like we're still in that state. I think I may have learned 3 things just this morning, but I think looking back now, again, I like to plan. I think a lot of safety people like to plan. We like to plan and prevent and protect. And I probably hung on to that illusion a little too long in the first few weeks, and wish I would have realized, okay, we need to back burner some things and shift in this way. I think that in the beginning, the optimist in me thought that this would be much more short-lived than it actually will be. And so I would have put some better communication structures into place for our team, because we were working in different locations, scheduled more frequent meetings to make sure that we're all on the same page, and so that we're all kind of working from the same playbook. And then the other thing is that, I think it's important that we cut each other some slack. There's an aspect to this pandemic that is different than any other situation I've ever worked through in my career. And that includes even how things changed after 9/11. There's a huge human and personal aspect to this, where your employees are trying to figure out their childcare, or perhaps going through health issues themselves. And so I would say just remembering that everybody's doing the best they can to let people know more often. Listen, we're all doing our best. Let's have each other's backs within the department and within other departments, and just work together better in that way.
Yeah, absolutely. Now is a wonderful time to be very generous with praise and with acknowledging hard work. Burnout is real across a number of different things, and we are here for a marathon, not a sprint. And I think that right now we're at this point, right, where a lot of people who started sprinting are realizing that that is not going to keep working, and that kind of burnout can lead to some decisions that you normally wouldn't make if you had the sort of mental centeredness from a more risk-aware perspective.
Well put.
Yeah.
Just before we move on to the Q&A portion here, a quick update on our upcoming webinars. So coming up next week, we've got Safety, Culture, and Trust, which is preparing for on-site repopulations. With everybody walking around different buildings, putting on masks, putting other people's safety at hands, safety culture is just really going to be a critical part of how reopening goes. Introduction to the Then, no problem. And then also one looking at facilities and maintenance personnel. As these folks are going around maintaining your buildings and your locations, how do we keep them safe in a lot of situations where they may need to be in closer proximity with one another, or have other problems that require some creative problem solving. And our brand new one coming up in late July is going to be a focus on face masks. So there is a lot of talk about face masks, details about their construction, their use, their distribution, PPE, risk reduction. We want to dive into that one, really sink our teeth in, and have a great discussion there. And then just a sneak peek at the future ones coming up, we've got one coming up on disinfection tactics, and technology, and one on contact tracing strategy and execution. Look for those in August. And if everybody wouldn't mind going ahead and taking a look at this poll we have here, these are the community connection webinars, and we rely on you, our community, to kind of guide us towards what topics are most interesting to you. So every week we try to, when we have these webinars, ask you questions about the topics you're interested in, what you'd like to see, whether you or maybe you know somebody who would be interested in being a panelist, so we can keep these going, as the panelists are definitely one of those things that are the biggest limiting factors in having more of these in the future. And then we've also been thinking about whether or not there would be value in having a group discussion that happens outside of these webinars. It seems like there's a lot of conversation happening, and we want to provide everybody with, a forum if it's necessary or useful to go ahead and keep these conversations going, asking questions and having that go on. So while we have this webinar poll going, we'll move on to the live Q&A portion here. So just a reminder to our panelists, you can go through the Q&A and identify questions that you'd like to answer. But Marcus, I'm really glad to see your top voted one here about undergraduate students has gotten so many responses. I'm gonna call that one answered and then just move on to Chris's question here. So to our panelists, Chris is wondering, what aspects of a second wave do you expect would be predictable based on our experiences over the past few months? What aspects do you expect might unfold differently? And this gets into a little bit of what I find myself very interested in, which are these unknown unknowns, right? How do you uncover those things you don't know yet? So Anne, if you don't mind taking this one first.
Sure. As I think that we've probably seen throughout this pandemic is that it's very depending on where you actually live and where people are coming from. And I think in higher ed, we're very much challenged because we have people coming from all over. We have people living together. And we also have to be very cognizant of the way that we can do all we can when our students and faculty and staff are on our campuses. But what we can't control is what is going to happen when they're not in class or they're not doing their research. And just the nature of the beast of people wanting to be in a college community, experience everything. And I think as health and safety professionals, the best that we can do is to do what we can, prepare for the worst on campus, make sure that we're doing our best where we can, and then set up some education as telling people, hey, you have to take it upon yourself to do that. Unfortunately, you see it right now. People are arguing about where to wear masks or practicing social distancing. And here in South Carolina right now, I can tell you we're in an upswing right now. And I can go to the grocery store. I can go to drop off my dog to get dog groomed. And I'm wearing my mask sitting in the car dealing with the employee that from the grocery store or from the dog place. But no one else is wearing masks. No one else is practicing social distancing. And so until people take it seriously, I have a big concern that it could take off when you start bringing everybody back on campus. And so, I mean, we're doing it slowly. We only have a small percentage of researchers right now. In order for them to come to phase 2 for their research, they have to have a plan, and then also for phase 3. So we're trying the best that we can, and that's my perspective, and I think it is going to be driven by what's going on in whatever university or whatever part of the country that you're in. I don't know if anyone else has anything else to add to that.
You covered it so well, Anne. I agree with everything you just said, and I have the same thoughts that, we can, to the extent that we can promote good infection prevention practices on campus, it's very easy to walk off the campus grounds and people are going to socialize. And then we're also, subject to our regional pandemic dynamics versus, everybody coming from their areas where their regional pandemic dynamics are different. But yes, I think that the part that's hard to anticipate is how many positive infections you might have on campus, what the contacts are those, how is your university going to be doing the contacts tracing? And I know that like all of your institutions, we're planning that out right now, but that's, as Ann said, I think as an EHS person, it is our role to plan for the worst, hope for the best, but plan for the worst. And so we're in that same boat.
Yeah, totally agree. I mean, one of the things that I had to remind in some of our meetings with even the associate and assistant deans of research and trying to bring back research and ramp up research, is that, look, our job, what we're trying to do is risk reduction. I mean, risk is never going to be zero. It got to the point some people were trying to make such stringent, you know, almost like it's impossible. It's like, this is, you know, we got to keep in mind what we're trying to do here. We're dealing with people, okay? We're not dealing with machines. And so, you know, let's not make anything that's too stringent, but that's the best we can do. And again, even with the research community, and as everybody who's been in EH&S knows, some are very good at doing what they're supposed to do. Others don't care, and they're going to do what they want. You know, our job is not to police that. Our job is to provide the information, educate, and provide the best, you know, subject matter expertise we can based on the available data and science. And that's the key. And that way, when this happens again, which will, you know, inevitably, I mean, it's happening again. I mean, it's not really a second wave. I think it's just a continuation of this wave. You know, here in Richmond, one of the unexpected things, talk about you know, was these protests. Nobody saw this one coming. And let me tell you, you know, it's bad. I mean, hundreds and thousands of people, you know, most like 99% are wearing masks, but, you know, we'll see what happens. So we're getting a better handle of it, but the good thing is we have a system now. We've had time to develop it. It's not perfect yet. And as my boss likes to say, we're, you know, building this car as we're driving down the highway, you know, so, you know, that's essentially the way it is. So always be adaptable. That's the biggest thing. Make sure your team is adaptable.
Yeah, I think that recognizing the limitations of what your effect can be in these situations and just doing your best to really do the most within that sphere is a great way of trying to limit this feeling of you have to do everything, right? There's just too much to do. There are too many issues around dorm or building repopulations, around teaching laboratories or other common spaces that might cause issues that not all of us can really control or predict, that will just come down to culture ultimately and how invested people feel in their own safety, combined with their knowledge of how spreading works and their understanding of risk. Because, you know, we're all risk professionals here. It's a very ephemeral concept for people who are not familiar with it. I'm sure we've all had that experience recently where you're trying to talk to family or friends who don't have the same lived experiences of really dealing with what is risk. It's really hard to grasp. It's really kind of, you know, this mix of consequence and severity versus likelihood. And for a lot of people, that's far outside of what they think of on the day-to-day basis. So that kind of communication might help to shore up some of these places where you might encounter an unknown and be a little more agile to prepare for it if it shows up.
Yeah, the struggle is, real quick, is that, you know, we got to understand that there's risk perception and an actual risk. Mm-hmm. And communicating that to people, you know, can be challenging depending on the population you're dealing with.
Great. Chris, thank you so much for your great question here. So looking through here just for another question more related to the topic at hand before we move on to some of these, you know, really pressing questions about face masks. Looks like John had a question here about communication around PPE. So I know that was a big one at first, especially as people were ransacking areas looking for ingredients for hand sanitizer and face masks. What some people, potentially upper management, are calling PPE is not what EHS professionals would normally call PPE, such as cloth masks, surgical masks, disinfectant wipes, hand sanitizers. Is anybody else having this issue? You know, how have you dealt with this? And then also, while there may be a disconnect there about what PPE is from a technical point, is that, you know, an important difference? Is that something that is important to continue to define and differentiate, or is that something where there may be a little bit more space to allow differences of definition?
I can start that off. I know that we have been pretty, you know, adamant about making sure that we don't call face masks PPE because they're not. The cloth masks, the surgical masks, they're not PPE. We call those source protection, keeping things, but yeah, that is. And with that, there has been a lot of confusion as to, well, what if I have to wear an N95, in my lab? Do I still have to wear, a face cover over that? Or, questions about face shields and, over the masks, and will that protect, and things like that. And to a certain degree, things like face shields and face covers do provide very minimal protection of, aerosolized droplets, or at least aerosols, maybe better in droplets. But we are, when we do our training, and we are making everybody who's coming back now to the university, and we're slowly ramping up like everyone else, they have to take a training where a lot of this stuff is also discussed, and where to wear a mask, where not to. With the labs, we are stressing to them that, if you don't require respiratory protection like PPE, then, and if you have more than the allowable, depending on approval, then you have to wear a face mask, all public places. And we have gone and tried to explain what face masks are, and definitely not PPE, but that is an important distinction, I think, that needs to be made.
And I love this question because N95s have sure gotten their day in the sun now. Everybody knows about N95s, but we did run into this issue early on, the difference between a mask and a respirator or a cloth face covering. And so we have made a very concerted effort to not only develop some resources to clarify that for campus, but to work within the departments here on campus to make sure we're using the common language, accurate language, because it can be a real problem, especially when it comes to procurement. If you're ordering 10,000 masks versus 10,000 N95s, that's a big difference. And recently our biological safety staff has worked a lot on the difference in masks, but also helping people understand the difference between a disinfectant and a sanitizer. So our entire language has changed. The way we talk to each other now, it would have seemed so strange 6 months ago, but physical distancing versus social distancing. And, I do think it's really important for organizations to land on an agreed definition and kind of unified messaging around those terms.
And we also face the same concern about that. And so we have PPE, term of what PPE would be, and we call the cloth face coverings CPE, community protective equipment. And all of the fact sheets that we have put out for face coverings, we don't call them masks, and we basically have really separated that out. The biggest concern we have is that there are employees, as we're getting ready to come back to work, that really think that we need to provide them N95s to come back to work. Because a lot of the information that's floating out there on the internet about what kind of mask should you wear, what kind of a face covering should you wear. So you have two camps. There are people that don't want to wear masks and some that want to be more protective of wearing that. And so that's where our fact sheets have really come into play. But we did have that same issue of CPE, CPE, and then also gloves. People wanted to wear gloves all the time. And so that really made us, okay, let's talk about gloves here, and put out a bulletin about gloves, of how you actually should be using the gloves. So that is just, one of those things I think we're going to constantly deal with the supply and everything. And one thing that we did find out is we put out a mass email through, actually through our BioRAFT system, to all the PIs and lab managers requesting PPE that they would want to donate, so we could actually get more community, as well as N95s and gloves. And maybe you guys are probably in the same boat. We were getting N95s from people that we didn't even know were wearing N95s, and probably should not have been wearing N95s for their spaces. And so we were like, we ended up getting a lot of N95s donated, but we were like, so now it's like, okay, let's go back and revisit, why are these folks wearing N95s when they weren't even in our program, because they were able to purchase those on their own. So very, very important. It's interesting. You think all these years in health and safety, and no one knew what an N95 was or what PPE is, and now it's like standard language now.
Yeah, I'm just gonna jump in here before we finish up with this one, to say that Kaz has a really great comment here as well. In addition to community protective equipment, he suggests using the term social protective equipment. And I think that having those tools in your tool belt when you're trying to get people really bought into this idea of wearing a mask is not a stigma is just a great one. And I found that as well for myself. Wearing it all the time, even when I don't need to, just shows people that it's important. But also when you wear a mask more, you tend to be a little bit more sensitive to other people wearing them, I found. All right, great. Well, we are actually right here at the 4 p.m. mark for our scheduled webinar end time. And as with our previous webinars, we still have many other questions that we haven't had a chance to. So if any of our panelists need to drop out right now, we of course completely understand, and thank you all so much for your time. But we do have a little bit of extra time booked out here to go on if any of you are still available to chat for another 15 or so minutes.
I can stick around for 15.
Yep, me too.
All right, fantastic. So let's get to this first question here from Lisa. I've seen a few different ones here about just the difference between face shields, face masks, what the difference is in terms of how those can be used. So could you guys address perhaps using face shields? Is that something that could be a substitution for face masks? It seems like there are some places where you may need to go to your public health department for guidance there. But are there best practices that you've seen established around recommending those for things like instruction or laboratory oversight, or any time where you just need to be in space with another person for a while?
I can tell you that we have not landed on an answer for this, and the only place that we've talked about perhaps replacing a face covering with a face shield would be for instructors who could be amply physically distant from their class and would just like to have something more comfortable to speak in. And so that's really the only place that I know of on our campus where we've talked about them in lieu of a face covering. Other than that, it hasn't come up much.
Yeah, that's been a question about people wanting to wear actually the cloth coverings and a face shield, or just wearing a face shield, especially for people that are hard of hearing and deaf, so they can still lip read. There was an article, a couple different studies that were done, and I saw them through the AIHA, American Industrial Hygiene Association chat room on Catalyst of research that's been done. And the issue is with the face shields is that depending on how close someone is when they're wearing it, the aerosol still could be pushed out atop or below or underneath. And so are they as effective as a mask? And I think the jury is still out on this. We just don't have enough information. They're used a lot in healthcare, healthcare for splash. If someone's wearing either a surgical mask or even an N95 as part of, if they're dealing directly patient with patient. But the overall use, I think the jury still is out on that one.
Yeah, I agree. At VCU, I've actually, went around and this issue has mostly come up now, and it's come up mostly from different departments that are thinking and trying to plan for the fall when the students come back, because we are planning on opening up with, all the different, distancing policies and things like that. But so the tricky thing becomes, teaching labs. That's where this question is coming on a lot. And what I've been doing is trying to, see what other people are doing. And I think, and I've seen everything from A to Z. People are only allowing face shields to the instructors. Some are trying to see if it'll work to provide a face shield for all students, even in conjunction with with a face mask. I haven't heard face shield only. I've heard both face shield and but again, yeah, we don't know. And I think the jury is still out as far as, how aerosolizable this virus is. Is it just droplets, or is it truly aerosolizable? We're still figuring that out. And I think until we figure that out, then we can do the risk assessment. But if we have no idea what to assess, what kind of risk, we got to assume the worst, I think. So, I would think that, a face covering plus, a face shield, if you feel that extra added protection. But yeah, it's tricky. It's tricky. Again, building the car as we're driving down the street, we're figuring it out every day. We might have an answer tomorrow,
Yep.
And that answer will be
That's,
gone the next day.
that's what I'm
Yeah.
hoping for, is that all of a sudden, we'll get more information and, oh, yes, for sure, we know this. But I think that's a long time in coming.
Sarah, it looked like you had a question you wanted to answer from Mary.
Oh, which was the question? I don't see, I'm scrolling through now.
Yeah, about the PPE subgroup.
I may have clicked it. I may have clicked it accidentally. I'm happy to answer any question. I just can't find the actual question. Matt, can you read the question to
Yeah,
me?
of course.
Okay.
So the one here is from Mary, mentioning that she had a PPE subgroup that encompassed all that had sort of been discussed so far. So that she had managed to lobby the head of that group, who was the purchasing director, and had admitted that he didn't know much about things he's being told to buy, to change those names. And now they're using CPE and sanitizing supplies to help give more clarity to those requests, so that way it's maybe a little bit clearer to understand why there's those price differences for unlike items.
Oh, okay. Well, I can just comment, this is one of the things that I did not foresee or would not have foreseen in pandemic planning, how much the EHS and the purchasing folks on our campus would be in touch on a daily basis. Because as Mary pointed out, the purchasing staff, they're experts on purchasing and procurement, but they need someone to say, is this KN95, as the case has been sometimes this year, does this look like an okay product? Because we can only order it in lots of 5,000 or lots in 10,000. So and then sometimes by the time we're able to get them an answer, that stock is not available anymore. Mm-hmm. So we've been working really closely with our procurement folks, and sometimes we've had the conversation that I'm saying, this is not how we normally do respiratory protection. This is not, this is different. We're talking to people about how to reuse N95s. This is not how we normally do it. And they're saying from the purchasing perspective, yeah, this is not how we normally do purchasing either. So trying to, find that balance between educating each other on each other's processes, but not bumping up against each other's processes to keep things moving has been a challenge for us, but we keep working on it every day.
So this is actually something that I'm very curious about here. So question again to Larry and Ann, and also to our attendees. Feel free to drop this into the chat or into Q&A. If you do put it in chat, you can actually go to the drop down and choose to send your message to all panelists and attendees, and that way other people will be able to see your response. But have you experienced some of these difficulties talking to procurement, trying to get them to understand why you need what you need, and there aren't really the same kind of alternatives there for things that might seem similar, or any successful strategies for helping to get the things that you need during these times?
So I personally did not deal, luckily, I'm glad I didn't have to deal with that portion. But my understanding is that our procurement has been talking to our staff, and as a matter of fact, we were able to actually get orders in for N95s and other safety equipment very, very early on. The minute so our procurement got smart about it, and we're able to get some clarification, and we're able to put in orders, which some we're still waiting on, but we're on the queue, but very early on. So as things are back ordered as they become available, we get one of the first dibs as they become available. So, that was something that I think we work with them and explain to them what we need. And, but yeah, the other thing that our procurement folks did that was actually really interesting was, you have to think outside the box. And one of the things we did was we started looking at distilleries that are here in Richmond into making, instead of making liquor, making a sanitizer, and that has worked wonderful. So now we're able to use that to pass out. We're creating safety kits, health and safety kits for everyone returning to campus, which includes a cloth mask, these hand sanitizers, bottles, and we were able to procure some virucidal disinfectants or sanitizers for just desk and computers and things like that, and everybody's going to have this kit. And so this is something that we work not only with procurement on, but with our facilities and physical plant department, who also have a very good relationship with procurement. So using every whatever way, if you don't normally don't work with procurement, well, talk to somebody who does on a regular basis and work through that route. So I think that really helped us, making sure we got supplies, and we got lucky in that respect. We were able to get some decent supplies.
Fantastic. Anne, any experiences there for you?
Well, we tried early on, just like Larry mentioned, to try to get as many N95s that we could. We also ordered more PAPRs for our health clinics. And some of the equipment came in, some of it didn't. As a matter of fact, we ordered the PAPRs back in February and they just arrived today. I got notification. So that was a long waiting time, but it's okay because we're ready for the fall. The one thing that we have channeled a lot with is that we have worked with procurement to get the kits together to send out to all of our locations for masks and PPE, and we've been reviewing a lot what they've been purchasing. But we have some set contracts with certain vendors that supply South Carolina schools. And we have a very good working relationship with them. And so they've been able to find some things for us and then run them by us. But the one thing that we have saw, and probably you've seen it before, is the fact that there are a lot of counterfeit N95s and these KN95s. And our textile group here on campus has tested a lot of these KN95s that we got. And even if they had headbands, they still didn't pass the quantitative fit testing because of the material. And so that's been a big push with procurement. They bought a lot of this, but when we figured they could actually be used for face coverings, they're okay for face coverings, but they certainly are not your typical N95s for protection.
Yeah, people have asked me that question about KN95s, and I told them exactly what you said. I was like, look, the only thing I know is if you need something to protect you from an occupational purpose, then we can enroll you, in a respiratory protection program, give you a certified N95 that we know works.
Yep.
It's like KN95s. So it's like the best I can tell you is don't wear them for personal protection. You can wear them as a face mask, but that's about it.
Yep.
And I have no idea whether they really work or not, but apparently I didn't think they did, just because also the way they fit, the ear, mostly ear loops, I think.
They're most ear, yeah.
And yeah.
NIOSH, actually, the CDC has a link to the NIOSH testing of all of the ones that are out there. And it really shows the capability. And even if the material would pass their testing, the fit doesn't. And so that we've tried a lot of them and we haven't been able to fit test on any of them.
Well, and the thing to remember is that, these, if they're going to wear them at work, for whatever reason, they have to fit correctly. It's not, even if they were good, you can't just buy one. This is a message I've been trying to hammer in just the general public's head, friends and everybody who thinks they need to buy an N95 to protect themselves. I said, no, first of all, for many reasons, but one reason is that you're not going to know if it actually fits you correctly. And it's a false sense of security.
Well, that's something that procurement had asked too, is they said, well, we ordered all of these. Can we stop looking for them now? And I try to let them know that not everybody can wear these. And these are for people that actually need them. Right. But they didn't understand that. Everyone thinks an N95, you can just give it to anybody and it's going to fit. And that's not the case.
I just wanted to mention, so NAU is part of a Tri-U group. We're governed by one board of regents. And so you have University of Arizona, Arizona State University, and Northern Arizona University. All of the procurement groups within the Tri-U have been working together to procure things from vendors who really are only interested in selling things in huge amounts, mass quantities. And so I just wanted to mention that because our groups have done a really good job with that and had some success with that. So if you're having trouble, purchasing the quantity that you actually need for your organization, and you have the opportunity to partner with other groups and leverage that buying power, that has worked for our procurement group.
Fantastic. Just taking a quick look through here. You've got
just while you look real quick, is that also, and I think I saw it in somewhere in the chat or the Q&A, is that, also follow whatever the state mandates. I mean, here in Richmond, we are mandated to wear face masks, period, if we're out in public. It's just, and so if you know, if anybody's questioning and challenging the fact of where certain face masks or things like that, you know, always point to the directives. Us being a state university also, you know, we have to follow what the governor says anyway, but something to keep in mind as well.
Yeah, so we have about a minute left here, so I'm going to just read out a question here that called out to me personally, which is one from Tracy, which is if asking a team member how they're doing and their family is doing, and a member of your team answers if they lost somebody close to them to COVID, how do you support that team member remotely who is going through that significant trauma? I think that, you know, none of us really want to be, you know, have these questions of how are you doing turn into a hi, you know, how are you? Oh, I'm good. How are you? And then go about your day. So we have 4:15 right now. So if everybody has a quick answer here before we wrap up, feel free to just sort of share that out.
I would just say have resources ready to share. We've got a really great employee assistance and wellness group on campus. And so we have, you know, prepped materials, prepped resources for people to be able to give them, you know, somebody to call if they're struggling. So I would just say have that ready. Talk to your HR or any wellness groups you have on campus.
Yeah, we set up immediately communication about our EAP program. And I personally and my leadership, you know, if anybody needs anytime, we also developed real quick a different set of leave, approved leave for COVID specific things outside of anything else. So we did that right off, you know, the bat. And we are very liberal with letting people need to do what they need to do.
I echo with both Sarah and Larry said. We actually put out early on, the EOC did all resources available, and I made sure that we share that with my team. In addition to that is to really let them know if they needed the time off or if they felt stress in any way, that they did have that leave option for COVID. I always consider myself more of a mentor than a manager, and so I try to really get to know the folks and really reached out to them. But we do have a pretty good EAP and a stress release, and we actually did a lot to keep people going by getting free online memberships to various exercise programs and nutrition and ideas and sharing certain things that can help folks. But yeah, you need to have those tools ready and available because it definitely will happen.
Okay, well, thank you so much to our panelists for your thoughtful responses and really thorough answers. Just like, sure, if we were unmuting everybody, we'd hear some pretty thunderous applause here. So thank you so much for your time and for your energy for this webinar. And I look forward to seeing everybody else next week when we're going to be talking about safety culture and trust around preparing for on-site repopulations. So thank you again to everybody, and I will see you all next week.
Yep. Thank you.
Thank you.
Matt, nice to talk with everybody. Bye.
Yep.
Bye.
Bye, everybody.